Alright, we haven't started. Are we ready to start now?
You guys already started. Someone posted on Facebook.
Alright, here we go.
Wow,
We're going to start with the
Shut up.
pelvis, okay? There are 3 bones that make up the pelvis, or at least one half of the pelvis, right? One half of the pelvis is called the coaxa, C-O-X-A. That would include this bone, which is the ilium, sometimes also called the iliac. We slide down here. The front part of here is the pubic bone, and then the back part of this is the ischium. So the pubic, the ischium, and the iliac all make up the coaxa. All right. This is one coaxa. This is the other. Right. So if we go back now and look at the ilium, the top of it is called the iliac crest. If we slide forward, so we're anterior, this little point here is called the ASIS, which is the anterior superior iliac spine. Everybody usually can palpate that right on them in the front. If we slide to the back and follow the crest down, we get a big knot right here. That is the posterior superior iliac spine. So again, you can palpate that on yourself. I just reach around the back. You should feel that little knob back in there. If you slide down and look back at the pubic bone does articulate with the other pubic bone at the pubic symphysis. We have a big hole right here. That is called the obturator foramen. Then if we look at the ischium itself, we have a thickening on the ischium. That is called the ischial tuberosity. We have this indentation. That is called the acetabulum. The acetabulum is where the head of the femur will articulate in with the ischium. And then if we tilt it, there is a little protuberance back here, and that is called the ischial spine. All right, so that is the pelvis. If we look at the thigh, the main bone of the thigh is the femur. This is the head of the femur. We have the narrow part, which is the neck of the femur. We have our first big bump here. That is called the greater trochanter. If we spin it around, we have a smaller bump here.
Lesser.
That is called the lesser trochanter. If we look down the back of the bone, we have this little line that runs. That's called the linea alba. All right. If we turn it back over, we can see where the femur then flares. The flaring is called the epicondyle. Again, use the head as your point of reference. If it's on the same side as the head, then it's the medial epicondyle. If it's on the opposite side of the head, then it's called the lateral epicondyle. Now, if we turn around, we can see that we have these 2 rounded parts here as well. They go underneath and they will articulate with the tibia. The rounded part is called a condyle. So again, if we use the head as reference, if I'm on this side, then this is the medial condyle, and this would be the lateral condyle. If we look in the front, we have this little guy hanging out there. That is the kneecap or the patella. All right. Now we have 2 bones that make up the leg. Right. We have the tibia, which is the bigger one, and we have the fibula. Fibula is always lateral. All right. Now, if we look up top, we have this flaring, but then it also comes to a flat surface. This is not called an epicondyle; it's called the condyle.
Can you rotate it a little bit towards? Yeah.
Anybody else? So this is the medial condyle of the tibia. If we look here, then this would be the lateral condyle of the tibia. We have a little spot right here in the front, right? That is the tibial tuberosity. If we look down and go to the distal end of the tibia, we have a protuberance here, which is the medial malleolus, right? That's a little bump on the inside of your ankle. If we look, we have one on the outside as well, right? That just is on the fibula. So this is the lateral malleolus of the fibula. The other structure on the fibula that I have to know is this is the head of the fibula. All right? If we go down to the ankle, the bones of the wrist were the carpals. The bones of the ankles are called the tarsals. You do have to know 2 names. You have to know the heel, right, which is this big bone here. That is the calcaneus. All right? The calcaneus doesn't really articulate with the tibia. The bone that makes up the ankle joint is this one, which is called the talus. So we have the talus and we have the calcaneus. If I point to any of these bones here, then you would just tell me they are the tarsals. The bones that make up the most of the foot is the metatarsals, And then we have phalanges, just like we did finger-wise. So we have a proximal, a middle, and a distal. The great toe, of course, having the proximal and the distal. And that's the show for today.
Where's the head of the
Cut.
kidneys?